Hello everyone, welcome in this new video. In this video, we will discussing about the best practices or best methods for measurement of blood pressure in any individual. So let's now start the discussion. The room in which we are recording the BP should be quiet. Apart from that, there should be no any conversation between the person recording the BP and the person in whom we are recording the BP, as it is found that if there is any kind of conversation between the person and the recorder, it may overestimate or it may enhance recording the blood pressure by 10 mm of mercury. The room in which we are recording the BP should be comfortable in the sense of temperature. It means there should be not too much cold in the room and it should not be too much hot while recording the blood pressure, as we know that because of too much of cold may increase the shivering in the person and it may enhance the blood pressure level. The person in whom we are recording the BP, his or her arm should be bare. There should be no layer of cloth around his or her arm, and this arm should be resting at the heart level, as it is noticed that if the arm is not at heart level or it is below the heart level, it may enhance the blood pressure level by more than 10 mm of Hg. Person should be sit upright in the chair. The cuff of the blood pressure device should be right above the elbow on the bare arm. If person is not with bare arm, if there are layer of cloth or if the cloth is tightly on, then it can enhance the blood pressure level by 5 to 50 mm of Hg. And we should also keep in mind that the lower edge of the cuff should be around 2 to 3 cm above the elbow crease. The person's legs should be uncrossed and feet should be on the floor. It is noticed that if the legs are crossed, then it may enhance the systolic blood pressure level by 2 to 8 mm of Hg. As I have already mentioned that both feet should be put flat on the footrest. The person's back should be straight and supported, as it is found that if back is not straight and not supported, then there may be overestimation of the diastolic BP by 6 mm of Hg. It means the recording of the diastolic BP will be more than 6 mm of Hg as compared to the normal level. Now let's discuss about the various recommendations for the BP measurement. Firstly, we will cover about the conditions. Conditions means condition of the environment as well as the condition of the individual in which we are recording the BP. So the room in which we are recording the BP should be very quiet and the temperature of room should be comfortable. Person in whom we are recording the BP should avoid smoking, consumption of caffeine and doing any kind of exercise for 30 minutes at least. That individual should not be engaged in any kind of physical activity at least 30 minutes before the BP recording. Bladder of the person should be empty. Person should be remain seated and relaxed for minimum 3 to 5 minutes before recording of the BP. As we have already discussed, neither the patient nor the staff should be talking before recording of BP, during recording of BP, as well as between the measurement. Person should be avoid watching the TV, using phones or any other kind of device. Now let's discuss about the recommendation for the position of the individual. So the individual should be in sitting position, means BP should be recorded in the sitting posture. His arm should be resting on the table. Mid arm should be at the heart level. Back of the person should be supported on the chair, and as we have discussed, legs should be uncrossed and feet should be put flat on the floor. Person should avoid wearing any bulky or tight clothing. Now let's discuss about the recommendations for the devices. So preferably we should use recording the BP by validated electronic, that is oscillometric upper arm cuff device. If such kind of device is not available, then we can use a calibrated auscultative device, which can be either aneroid or hybrid, and the BP recording should be used hearing the first Korokov sound for the systolic BP and the fifth Korokov sound for the diastolic BP, and with a low deflation rate, that should be 2 to 3 mm of Hg per second. Now let's discuss about the recommendation for the cuff. So the size of cuff should be according to the individual's arm circumference, as smaller cuff can overestimate, it means it can record the blood pressure more than normal, and larger cuff may record the blood pressure lower than the normal. If we are using manual auscultatory device, then the inflatable bladder of the cuff should cover around 75 to 100% of the individual's arm circumference. But if we are using the electronic device, then the cuff size should be according to the device instructions. Coming to the protocol, at each visit we should take 3 measurements, and these 3 measurements should be taken at least 1 minute apart, and we should discard the first measurement and we should take the average of the at least 2 measurements. Now let's discuss about the ideal situation for the recording of BP if we are using the auscultatory method of blood pressure recording. So as we have discussed, that cuff should be at the level of heart. While increasing the pressure in the cuff, this pressure should be increased rapidly to 30 mm of Hg above the level at which the brachial or radial pulse is extinguished, means disappears. The stethoscope, the head of the stethoscope should be placed over the brachial artery, and we should slowly deflate the cuff, and the approx rate should be 2 mm Hg per heartbeat, and we should avoid the rapid deflation by more than 3 mm per second, as it can underestimate the systolic BP and it can overestimate the diastolic BP. So deflation should be at the slower rate, and the recording, the measurement of systolic and diastolic BP is based on the Korokov sound, as the systolic BP can be recorded when this Korokov sound is appear first, and the diastolic BP is measured or marked when there is disappearance of such Korokov sound. Now we have come to the end of this video. Please like and share this video with others. Thank you so much.